Good evening, gentlemen, ladies and gentlemen. Welcome to Thursday's edition of Health Surgeries UK. My name is Dr. Mekella Mehmet Yesil. I'm broadcasting live from Enfield, from my office today. And on the show today, we're going to be speaking to a professor from Istanbul in Turkey, who's going to talk to us about heart health. And his name is Professor Dr. Mehmet Kaya. Good evening, Dr. Kaya.
Good evening, Mekella.
How are you?
I'm doing great, and
You're
it's a
great.
great honor. It's a great honor to be here with you.
Thank you so much for coming onto my program this evening. It's an honor to have you. Thank you so much. How are you?
Actually, we are doing well. Everything is okay. All is well with me and my country and Istanbul.
In Istanbul.
Because
Istanbul is.
because Corona is about to finish.
Oh
Because of that,
wow!
we are very happy with that.
Oh, I'm so glad to hear that. It's really good. We're
Yeah.
slowly getting there. We're not quite there, but we're getting there slowly.
Okay.
But yeah, it's not too bad. How's the weather?
How is the
weather?
weather?
Sunshine?
Uh, we are in a spring season now,
Okay.
and summer is about to come Turkey, and sun is perfectly shining.
Oh wow, lovely. Well, we're having some
Yeah.
horrible weather at the moment, but never mind. It
Oh,
is what it is.
but England weather is always
Oh, right, it's
same.
English weather, always the way.
Yes.
Right, Professor Kaya, what I'd like to do, before we start our program and I present the questions to you, if you can
Okay.
just explain to our viewers a little bit about what you do in Turkey, what your role is. I know you're Assistant Professor of Heart Cardiology in Istanbul, but if you can explain a little bit about yourself, take your time, just relax, don't forget to
Oh,
breathe, and explain
okay.
to people what you do.
With pleasure.
Mhm.
I'm currently working as a cardiac clinic chef with the title of Associate Professor in the Department of Cardiac Surgery in Istanbul Mehmet Akif Ersoy Training and Research Hospital. I did my degree and obtained my MD from Ankara Gazi University Medical School.
Oh, that's.
I graduated from this university in 2003, and
Wow.
I have been performing open cardiac surgery cases since then.
17
I
years, it's a long time.
I performed over 8,000 cases so far now
8,000?
actually.
Is that in
Yes,
Turkey alone?
yes.
Okay.
It's huge number. I am aware of this. But my position is actually is very important in Turkey. Because of that, my patient's burden is very heavy.
Mhm.
But we are accustomed to do things
Mhm.
actually. No
Mhm.
problem for me.
Yeah.
And my team are involved in many projects in
Yeah.
my hospital. Uh, and it is very important thing. Actually, after the completion of residency program, I
Mhm.
became specialist in my country, but I worked in Belgium for a while as a fellow.
Okay.
And yeah, after that, I interested into minimally invasive cardiac surgery.
Okay,
Uh,
minimally invasive. Right. Okay. Yeah.
yes. Uh, and my hospital actually created my career,
Okay.
especially my manager.
Okay.
He is dedicated to excellence because
Mhm.
I learned from many things from him, especially how to be a good player,
Mhm.
dedicated to excellence,
Mhm.
etc. Actually.
Okay. So roughly how many sort of procedures do you do a day with heart surgery? How
Yeah,
many
yeah,
roughly?
yeah, yeah. Actually, it's common question for me, and surprisingly, uh, I regularly do every single day
Every single
one
day?
every single day one case. But
One case.
sometimes,
Okay.
one case. But maybe you don't believe this.
I
You
believe
can't believe this.
you.
No, you can't
Yeah.
believe this because it is very surprising for my country. Uh,
Yeah.
Sometimes I operate on two cases at every day.
Okay. Not the
Uh,
same time, I hope.
No, 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 no.
Okay.
It is impossible.
Yeah.
Istanbul is very crowded, and
Yeah.
16 million people lives there, and
Yeah. Yeah.
only there are three cardiac centers, and
Okay.
yeah, one of them Anatolian side, two
Hmm.
of them on
European side.
I'm sorry, European side,
Hmm.
and European
Hmm.
side there is one, and
Hmm.
I'm working there because of that.
Okay.
Because of the patient's burden is
Hmm.
too heavy, actually.
Hmm. Yeah. With the cases that you're seeing at the moment, if you don't mind me asking, Professor Kaya, do you see many cases where you have to operate on children, or mainly elderly? Would you say, like, do you
Yeah,
do many operations on children, or would
uh,
that be the role of somebody else?
yeah. I was educated for congenital heart surgery. I mean,
Yeah.
child
Yeah.
surgery,
Yeah.
but I quitted my career about that because I had to choose which one of
Which
them.
area you was going to perform? Yeah. So
Yes,
adults. You
and
chose adults.
I preferred, yes,
Yeah.
adult cardiac surgery.
Yeah.
Why? I don't know. I don't know, but
Okay.
uh,
Probably because
doable,
you want to
learnable. Yeah.
become attached to the child and seeing things go wrong, or obviously the good things as well. But yeah, that's
Yes, and
good.
learning curve is steep in congenital cardiac surgery.
Mm-hmm.
Yeah, very
Yeah.
steep. Yeah, because of that,
Yeah.
maybe I don't know.
Okay.
I felt it actually. I
Yeah,
felt
of
that.
course. Right. Okay. Well, thank you so much for telling us about your story there. What I'm going to
Yeah.
do, Professor Kaya, I'm going to ask you your first question. So, your first question, which I'd like to present you with, is basically, what is a healthy heart diet? What do people need to do to get healthy with their heart? What do they need to
Uh,
eat?
Actually, there is much information everywhere about
Mm.
that, but
Mm-hmm.
people are always inclined to eat a delicious food because
Okay.
of yeah, because and
Fast
delicious
food.
food.
Fast food.
Yes, yeah, fast food,
Yeah.
processed food.
Yeah.
Uh, b-
That's the
uh,
worst.
but unfortunately, they are very harmful to our health.
Yeah.
Nothing to be done about that,
Mm-hmm.
actually,
Mm-hmm.
because those foods are everywhere also.
Mm-hmm. Of course. Yeah.
Uh, in my opinion, we should follow simple tips.
Mm-hmm.
It's I'm sorry. Yeah. Okay.
Like
Uh,
food, like as in like
yeah.
more vegetables, more fruit,
Yeah.
less red
I would say,
meat,
yeah.
more fish, more nuts,
Yeah.
more tuna,
We
mackerel,
yeah.
salmon.
Yeah. We should
Hmm.
eat more fish. Why?
Okay.
Because it's a perfect a good source of protein and omega
Omega.
3 fatty acids.
Okay. Yeah.
Uh, yeah,
Yeah.
and
That,
and
yeah.
I'm sorry,
That's
and
okay.
we should eat more chicken instead of red meat,
Yeah. Because more
and also,
protein.
yeah, and also whole grains, nuts, almonds,
Yeah.
uh, fibers.
Walnuts. Hmm.
Yes, fibers from vegetables,
Hmm.
uh, uh,
The
and
antioxidants, like berries,
yes, yeah,
strawberries,
yes,
ackee berries, blueberries, and stuff like
yes,
that. Things that have
fruit,
high
yes, and
antioxidants. The
yes,
darker
and
the fruit, and the vegetables we know is obviously high in nitric acid, or nitric oxide rather, and basically that is better for the heart health, for like your arteries and the blood supply and everything else. Because the more nitric oxide there is, the better the arteries function. That's correct. Like beetroot as well is
and
one of them.
yeah,
Celery, radishes and spinach, stuff like that,
yeah.
and water.
Yeah, yes.
Yeah, water.
Yeah, we should drink more than 2 liters per day. Per
Yeah,
day.
yeah, yeah, yeah.
And Mekala, there is very important thing. There are two types of oil,
Mhm.
saturated and unsaturated.
Mhm.
And unfortunately, such as bacon or
Mm.
uh, processed food is
Mhm.
full of saturated fat, and that
And
saturated,
salts. Mhm. Yeah,
yes, salt, and
yeah.
saturated oil can collect on the wall of arteries,
Mhm.
and unfortunately, it can narrow our arteries and
Mhm.
it can blockages.
Yeah. That's right. So we're talking
Yes,
about atherosclerosis, aren't we? The blocking of the arteries,
yes,
where it becomes
atherosclerosis.
calcified. It becomes calcified. So basically, it's like when you look at a hose pipe, and the hose pipe is blocked because the water's not coming through. So because it creates a block, and it also
Yeah,
increases the blood pressure. That's right. Okay, so
and,
that's
and
about the heart. Yeah.
yes,
Carry on.
and Yeah, okay. You can
Yeah,
ask me.
okay, yeah. Okay, a healthy living for heart patients. So you've got your patient, they've just had heart surgery. Um, how how would you sort of like recommend that they go on after surgery? How would you recommend?
Uh, heart living. You mean heart living? It's
Yeah, healthy living with heart patients. Yeah.
healthy living. Every single person should be following heart living actually.
Mm-hmm.
Uh, Mekelle, approximately 7 million people around the world
Mm-hmm.
die from
Cardiovascular disease. Yeah.
yes, cardiovascular disease per year.
Mm-hmm.
Uh, and genetics, lifestyle,
Mm-hmm.
environment are the major component of
Mm-hmm.
this factors.
And
If
stress.
yes,
Stress.
if we manage to stress, yes, we are going to live a good life.
Mhm.
And there is association, American Heart
Yeah.
Association and
Yeah.
European Heart Association.
Yeah. We met there
Uh,
last year. Yeah.
Yes,
Yeah.
they always say yes. We should reduce our stress level
Yeah. We
because
should. Yeah.
yeah, because stress always triggers
Mm-hmm.
blood pressure and blood
Blood sugar,
sugars.
glucose. Yeah.
Yes,
Mm.
and it is not our topic, but cancer.
Mm-hmm. Yeah.
Yeah,
That's right.
stress, yeah, you know better than me.
Yeah,
Yeah.
of course. Yeah. Another thing I was going to say, smoking and drinking, alcohol and smoking. Those are the two prominent things that we see in society today, because obviously people drink because they're stressed and they smoke because they're stressed. And I see this even in hospitals where I've worked, where even the doctors maybe or the nurses, they have a cigarette on their break, but they don't have anything to eat. So obviously that accommodates the stress as
Yeah.
well, unfortunately. So
Mekele,
smoking and
yeah. Did you notice that smoking is commoner in young women than
men.
men?
Yeah, that's
Yes.
right. Because they have children, they have the house to keep up with, they have their finances. So there's so much going on in their life to juggle work and family. It's very difficult for any woman anywhere, especially during these times, I would say. Definitely.
Yeah.
But yeah,
Briefly, healthy diet, stress,
limit
hypertension,
stress.
diabetes, blood pressure, and
Mm-hmm.
exercise are
Hmm.
the major component of heart living. Yeah, good
Hmm.
health.
Do you think
Uh,
genetics play a part as well? So, say for
oh,
example, if we had somebody, I don't know, I could give my father, he's got AF, so arterial fibrillation. He's okay though, he's been managed, but would it be something that would be passed on through a gene, do you think?
yeah, genetics, unfortunately, inevitable thing. And if anybody
Mm-hmm.
dies from in younger age in your relatives or
Mm-hmm.
extended family, oh, we should think yes, genetic factors and um, fortunately, doctors, you should keep up with your doctor's visit because
Yeah, that's
uh,
right. Yeah.
yeah,
Just get
genetics
checked
very
out every so often. Yeah.
yes.
Usually every
Prefer,
6 months. Yeah.
yeah, if anybody dies before the premenopausal period, for example,
Mm-hmm.
uh, generally we see the atherosclerosis in women after 40s or
Mm.
60s age.
Yeah, because the
But
metabolism slows down.
yes,
Mm.
yes,
Mm-hmm.
uh, and we must quit smoking,
Mm-hmm.
and we shouldn't be around second-hand smoke.
Oh, secondhand smoke as
Yeah,
well.
yeah, I think that smoke is
Okay,
also
that's
important.
very interesting. Yeah. Yeah, that's very interesting. What do you
Yeah.
say about people who vape? Because obviously you get people who say, "Well, I'm not taking in, nicotine. I'm just having a vape." I mean, I know they've associated some cancers with that now, especially with the esophagus. What's your view on that? On vaping? With the steam smoke, the electronic
Uh,
cigarettes.
um,
From your
Actually,
experience.
yeah, okay. Yeah, many people, many patients says like that. Oh, I don't smoke, but
Hmm.
it triggers emotion.
Hmm.
Actually, yeah,
Hmm.
it is in my opinion. Frankly,
Hmm.
don't get me
Hmm.
wrong,
Yeah.
please.
Yeah.
Yeah,
Yeah. Yeah.
it is exactly same.
Same thing. Okay,
Yes,
that's interesting to know.
I hate like this. Yeah,
Yeah. Yeah. Of course.
I don't
That's
smoke. I don't smoke because of that.
Yeah, well, I hope not because you're a heart
Yes,
surgeon.
and
Okay.
there is a denial among the
Mhm,
people
mhm.
for oh, it's not going to happen to me.
Oh, yeah,
Always
that's always the
people
way.
say,
Yeah.
yes, they are still smoking because of that.
Well, yeah, there's pros and cons, I guess. You're going to get people who
Yes.
are saying, "Well, it's not going to happen to me," or "I smoked 100 cigarettes and I lived to 80." So it depends, I suppose. Okay, well, thank you for that one, Professor Kaya. Okay, let's have a look. Third question: heart healthy exercises. What do we do?
Uh, uh,
That's an
uh,
interesting one. Do we buy a
yes, yes,
bike? Do we get a dog? What do we do?
yeah. What I am doing,
Yeah.
I do yoga
Okay,
regularly, 2 days in a week,
twice a
and
week.
yes, yes,
hmm
and swimming also.
hmm
Uh, and I prefer to walk uh, everywhere.
Everywhere.
Uh,
Okay.
yes, yes. Uh, we, we intellectually
hmm
every person understand. Yes, we need to talk. We
hmm
need to exercise.
hmm
We need to swim.
hmm Walk.
We walk. Uh, these factors are reducing
hmm
also stress level
hmm
and make us in a good shape
Yeah.
in the of our body. Because
hmm
if we are able to in a healthy range weight,
hmm
yeah, it means we avoid our body from cancer, cardiac disease,
hmm
uh, something
Stroke.
like that. Yeah,
Yes,
stroke. Yeah,
stroke and things like that.
stroke.
Okay. So
But
obviously a healthy diet, healthy exercise is all good. What would you say to somebody? I mean, there was an instance where one of my patients many years ago um, came in, he was severely obese, wanted to have bypass surgery, obviously
mm,
to sort of like bring down the weight, didn't do that, decided to buy a dog. 6 months later, came back to the clinic, and I looked at him and he'd lost like 3 stone in weight just by buying a dog. So didn't have the bypass surgery for the gastric bypass, bought
oh.
himself a dog and lost weight because he was walking the dog 3 times a day. So, in effect, they say a dog is a man's best friend. So, maybe buying a dog and taking it out for walks 3 times a day might
Yeah,
help save on the cost of a bypass surgery. So, yeah, but that was
yeah.
one of the things that happened to me because one of my patients who was severely obese lost 3 stone in like 6 months, and obviously changed habits and eating. So that was one of my stories anyway. Okay.
Yeah,
Mm.
it's a good story because the dog is always perfect,
Man's best
healthy.
friends.
Yes,
Yeah.
at the same time, Fred. Yes, at
Yeah.
the same
Well,
time.
what would you say to people who want to have bypass surgery? Do you mind me asking you just that one very quickly? So people who want to lose weight, and I've seen some people they don't do it so much here. They go to Turkey, they have the gastric bypass surgery of the stomach to help them lose weight. What would you say on that? Would that be a way to have a healthier heart? Do you think?
It's a tough question actually.
Because it's mentally up here as well, isn't it?
Yes.
For obese people.
Yeah, this surgery is beneficial.
hmm
Yeah, it's absolute
hmm
situation. There is
hmm
no any doubt about that.
hmm
But
Okay.
but in my opinion, it's not a halfway
It's not a
because
healthy way, yeah.
yes, because surgical operation is always traumatic thing. I
Yeah.
mean, like a hit to train you.
hmm
Uh, but if we care about our foods, exercise, stress,
hmm
stress management, also,
hmm Yeah.
etc., we don't have to go
To
this
the
surgery.
extreme measures. We don't have to go through extreme measures
Yes,
to sort of like lose weight. Okay. So it's basically changing up here, changing the way we
yes,
think and adapting to new methods. And yeah, I understand completely. Okay. Well, that would be good to know. Let's have a look. Fourth question. So what do we know about the warning signs? How do we know if we're at risk from having a heart attack? What sort of
y-
things happen to people and
yeah,
at whatever age? What would you say? What do you usually see with your patients, Professor
yeah.
Kaya?
It's a perfect question. Why?
Mhm,
Because population is always population is thoughts always heart attack is the major symptom of heart disease.
mhm,
Heart disease is a broad term. Heart attack is only one side,
mhm,
but heart attack is intimidating and always make people fearful. Because of
mhm,
that, every person fear of heart attack. Because of
Mhm.
that, I elaborated
Mhm.
heart attack symptoms. Unfortunately, sometimes may be vague.
Mhm.
For some nausea,
Mhm.
pain is important.
Mhm.
Shoulder pain, back pain, even abdominal pain
Mhm.
may be the symptom of a heart attack. Uh,
Okay.
but surprisingly, some patients with diabetes may not feel pain
Mhm.
because diabetes, you know better than me,
Mhm.
diabetes can affect the nerve that
Mhm.
carry pain. Because of
Mhm.
that, some patients
The insulin factor, yeah. Yeah.
yes, yes,
Or the
uh,
metformin, depending on which way it goes, yeah.
yes,
Okay, yeah. That's usually
and
the case, yeah.
but chest pressure and
The heaviness on the chest, it's when you get like tightening, pain in your
yeah,
left arm, like
yes,
numbing.
yes.
Okay. Maybe jaw pain on the left side. Sometimes you get like a jaw, locked
You
jaw.
you 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 are exactly right. And
Mhm.
sometimes one symptom is not sufficient for attack. But
Mhm.
if any patient, if anybody
Mhm.
feel the jaw pain and in conjunction with the other symptoms such as
Mhm.
nausea,
Sickness.
yeah, sickness and shoulder pain, back pain, yeah,
Mhm.
that could be a sign of heart attack. But
Yeah.
again, surprisingly, elderly patient and young women
Mhm.
normally tend to get heartburn in their chest,
Yeah.
and
Mhm.
their symptoms, their feelings are generally vague or not certain.
Okay.
Yeah, but pain is the major symptom. Pain.
Pain. Okay, so it's pain or feeling uncomfortable, like sweaty,
Yes,
hot, anxiety maybe brings it on.
yes,
Okay.
anxiety,
And
and
sometimes
some
it's like a type of angina, isn't it? They sort of get like an angina, like they feel like they've got a taste in their mouth, like an acid reflux, like a like they've got like a
uh,
burning, you said.
yeah. You are very
Hmm.
right. Uh,
And
and
sometimes sleepy and tired, that's a sign as well.
per-
Tiredness. Tiredness.
perfect.
They tend to sleep after a big meal. So,
Uh,
and obviously, again, portion
and
sizes of
and
food should be minimal.
yeah,
Yeah.
and edema, especially in
Edema,
the
yeah.
ankles,
Mhm.
for example, and
Mm.
rapid heartbeat
Yeah.
are,
So
are
swollen ankles and a rapid heartbeat.
yes,
Like a
yes.
tachycardia, like a tachy, anything over 100, is that right?
Yeah, maximum limit is 100, but
Mhm.
uh, there are lots of things causes
Mhm.
rapid heartbeat.
Mhm.
But generally, if the patients come in with rapid heartbeat or
Mhm.
swellings in their ankles, uh,
Okay.
yeah, we should test him or her
Mhm.
in view of heart disease, especially
Mhm.
silent heart
Yeah, yeah, that's
attack.
usually the case. Usually they get a warning before a big one comes on. Is that right? They start to feel unwell a few weeks before, a few days before? Usually?
Unfortunately, heart disease can strike any person at
Mhm.
any age of
Mhm.
our life.
Yeah.
Yeah.
Okay. Obviously, obesity is the big thing. So staying fit
Oh,
and well. So obviously, that's the big one. Staying fit and
yeah.
well and reducing
Obe-
fats.
Obesity and
Obesity, yeah.
smoking are the major
Mm.
factor, and
And drinking.
all the world is against
Yeah.
those, but they can't fight sufficiently.
Okay. Thank you so much, Professor Kaya. Okay, let's go to our fifth question. Let's have a look. If doctors recommend that we have coronary heart surgery, what does that actually mean? So, what is coronary heart surgery? If you could
Yeah.
explain that to me, Professor Kaya, please.
Okay. I am very happy with that question because I'm
Oh,
a
you
heart
do it all
surgeon.
the time. You've done about 8,000 or so already. Okay.
Yes, yes. Firstly, if we have a time, I would like the information about a little bit heart anatomy.
Mm-hmm.
Uh, Heart is located at in the center of our chest, and it is surrounded rib cage and breastbone.
Mm-hmm.
And we always, I'm sorry, we generally cut breastbone
Mm-hmm.
to reach the heart.
Mm-hmm.
But it is a horrible thing, I think.
Mm-hmm.
Why I'm saying this? Because I'm a minimal invasive cardiac surgeon. I
Mm-hmm.
I don't like cut or divide the breastbone,
Mm-hmm.
and I prefer to coronary artery bypass grafting
Mhm.
via mini hole
Mhm.
on the chest of our patients, and
Mhm.
we remove a piece of vein. It's
Mhm.
called saphenous vein, and
Mhm.
we take down left internal mammary artery from the patient's chest,
Yeah.
and we make reroute.
Mhm.
We establish
Mhm.
new circulation to the heart
Okay.
by using these vessels
Mhm.
called grafts.
Yeah.
Uh, Coronary artery bypass surgery actually it's horrible. Why? Because we generally stop the heart, and
Okay.
we connect the patient to the special device. It's called
Mhm.
heart and lung machine. Heart
Mhm.
and lung
So
machine.
the machine's actually pumping the blood and the heart at the same time and keeping the lungs open.
Yes,
Oxygen.
yes.
Yeah. Mhm.
Oh, yeah.
Mhm.
Blood is administered by this machine to the
Mhm.
patient, and
Intravenously. Yeah.
yeah, after we restart the heart and we
Mhm.
disconnect the patient from this machine.
Mhm.
Uh, this story wholly horrible, I think, because
Mhm.
we stop heart and we restart the heart.
Yeah.
Yeah, if patient, actually, if patient hear that,
Mhm.
uh, that
They can be
intimidation.
traumatized. Yeah, they can be
Yes, yes,
traumatized.
but,
Do you
yeah.
actually tell the patient you're removing their heart, putting in an artificial one while you're working on the real one? Do you actually tell your patients this?
No, no, no.
You don't tell them that. Okay. Probably not a good idea.
Yeah,
They probably wouldn't want to have the surgery
it's not a
done.
it's not a good
Yeah.
idea, but we always say, yeah, we use saphenous vein from his
Mhm.
or her leg,
Yeah. Yeah.
and we perform one or more coronary artery bypass grafting.
Yeah.
Uh,
Where you take it from the legs or something, or one of the veins from the legs, and then you attach it to the heart. Yeah.
Yes, yes.
Mhm.
Generally, they ask us risks and come
Well,
up
the
with
risk. Yeah.
that.
Yeah.
Yes, unfortunately, there is a mortality and nothing to be done about that because
Yeah.
we operate the diseased heart,
Mhm.
not normal heart, and
Yeah.
we stop the heart, and after the operation, the heart should be contract and relax normally.
Yeah. Yeah. Back to normal, so it starts beating as
Yes,
normal.
yeah,
Yeah.
because of that complex and delicate operation.
Mhm.
Uh,
Do you offer them life support after the procedure is done, Professor Kaya? Are they on a life support machine in intensive care while this is going on so that they can regulate normal breathing pattern and normal heart
yeah,
pattern?
sometimes we use this machine,
Yeah.
uh, but it's the last resort.
Last resort.
It's the
Okay.
last resort. Yeah,
Okay. Okay.
yeah.
Right. Okay. Well, thank you for that, Professor Kaya. Okay. Let's have a look. We're getting to our last question. So we've got about 5 minutes or so.
Okay.
Is it possible to reverse heart diseases without surgery? So rather than going under the surgeon's knife like yourself, um, would it be easier or is it possible to reverse the signs of obviously a diseased heart, would you
Uh,
say?
Yeah, unfortunately, we cannot cure heart disease completely. There is no
Mm-hmm.
cure, no miracle cure yet. But
Mm-hmm.
we can slow its progression
Mm-hmm.
over time, or
Mm-hmm.
we can see a regression over time with
Mm-hmm.
the medication. And
Mm-hmm.
every patient with heart disease should take the responsibility if they smoke or
Drink.
if
Or do
they
they drink? Yeah.
yeah, drink. People should pay attention to uh, blood pressure,
Oh, that's
yeah,
important. That can happen at any age.
yes,
Yeah.
yes. They should keep up with doctor's visits.
Mm-hmm.
They should take all medications.
Mm-hmm.
Uh, if they do, or
Mm-hmm.
if they don't exercise
Mm-hmm.
or forget this, yes, start exercise.
Mm-hmm.
Uh, if they make it routine,
Mm-hmm.
maybe they can slow disease progression. But
Mm-hmm.
unfortunately, we cannot abolish completely.
Mm-hmm. Mm-hmm.
There is no such a thing.
Yeah, of
There is
course. Yeah,
no.
obviously, it's re-educating the mind to adapt, and obviously,
Yes,
educating people that, you're overweight, you smoke 100 cigarettes a day, you're drinking X amount of alcohol, you need to reduce this, because 5 years from now, it's going to have an effect on your weight, on your bones, on your heart, on your liver, on your lungs. It's going to have an effect on everything that you do. And obviously, even on relationships, future relationships or anything like that. Or,
Yeah.
you do want to leave, if you're in your 40s, you don't want to leave a young family behind, or wife, or anything like this. So obviously it's imperative that we start taking
Yes.
our own health into our own hands. Nobody wants to go under the knife of a surgeon.
Yeah,
But
yeah, nobody
yeah, but
wants.
it's true, but it's one of those things. But so that we can't reverse it, but we can make those changes, like you said, the exercise, the diet, the mindfulness, the yoga, the swimming, the walking, the bike, the bicycle, even. And obviously the mentality has to change. And with food being so processed, so over, I mean, the way we manufacture food now, everything's in packets. Nobody actually wants to grow food in their garden or
Yeah,
go and buy
yeah,
organic
yeah,
food.
impossible.
Everybody wants to microwave or steam, or do something that's already prepared, that's been in a packaging or a tin. I find this all the time when I speak with people and patients who have like diabetes, high blood pressure, cholesterol, all of these things. So I guess you see it too. You see it
Uh,
too, I guess.
Actually, recommended strategy should be followed by every person.
Hmm.
And if you are worried about what you are able to tolerate,
Hmm.
then start as a part of cardiac rehabilitation program.
Hmm.
Uh, and intellectually, people understand how to solve this problem, or
Hmm.
what to eat, what not to eat, or
Yeah.
uh, how to do or how not to do.
Yeah.
Uh, but people inherently tend to or inclined to do delicious things, such as, or life habits changing is very difficult, I think.
Yeah, I
I
suppose
mean,
there's a psychology behind food, because people
yes.
want quick food now, they'll fast food rather than to cook it something from scratch. So it's, yeah, I see that. But I see a lot of youngsters now, actually maybe in their 20s and 30s, they're starting to eat a little bit more healthy because they're worried about what the future may bring, the cardiovascular, the high blood pressure and everything, the obesity. So a lot more people now, I think, will change, but it's just getting them to change, obviously, to adapt new habits, you know.
Yeah.
But yeah, hopefully. And obviously, another thing we forgot to talk about is the dark chocolate, because obviously it's got nitric oxide in it, and obviously it's very good for our health. So dark chocolate is good for us. So it's not all bad, is it? Dark
Uh,
chocolate,
so,
70% or more, is supposed to be better for the arteries, isn't it? It's supposed to be like an antioxidant. Dark chocolate, not the milk chocolate, the dark chocolate, plain chocolate. It's supposed to be
I
very good for you.
yeah, I don't know that actually. Actually,
Oh, really? I'll have to share it with you. I remember speaking with some nurses many years ago
please,
about
please.
chocolate cake. Chocolate
Yeah,
cake, to have it in the breakfast, is good for your heart health, believe it or not. Yeah.
actually, I would like to try it. I would
Yeah,
like
I'll
to try
have
it.
to, I'll share some more stuff on my Facebook anyway, so it's not a problem.
Okay,
Oh, but listen,
I will be
you,
content.
yeah. Is there anything you'd like to finish talking about, anything, or?
I, I, I will say two words. Keeps on
Mhm.
beating.
Keeps on
Yeah.
beating, keep the heart
Yes.
beating. Okay. Well, thank you, Professor Mehmet Kaya. You've been an inspiration to my program tonight. Thank you so much for coming on my show. Hopefully, yeah, I've been a good host, because last time you were the host and I was on your show.
Yeah.
So hopefully, um, you've enjoyed yourself. I've seen some comments come up, so people are thanking us on our stream as we've been talking. So I've been looking on here and say, so everyone wants to say thank you and well done for your input on our program tonight. We've had Jason D, we've had somebody called Nihat Tubai, we've had Erin Meto, we've had a few people, somebody saying about Chef Dali kebab, but I don't think that's a good idea. I don't think that's a good idea. Maybe
It's a
not.
Ottoman style meal in
Uh,
Turkey, in Istanbul. It's very famous.
Oh, is it
Ottoman,
really?
yeah, Ottoman
It's an
style.
Ottoman meal, is it?
Yes,
Okay.
yes, yes, yes.
Okay. Well, thank you so much again,
It
Professor
was, it
Kaya,
was,
so
it was,
much.
it was great. It means a lot to me.
Oh, thank
Uh,
you.
yeah, I thank you.
Thank you for coming on my show, and thank you to all the viewers, obviously. And somebody called Ozan Koyuncu, somebody's saying thank you again for coming on the show. So I'd like to thank all the viewers, ladies and gentlemen. Thank you for watching our program. You've been fantastic, and thank you for the positive comments coming in. And again, thank you again, Professor Kaya. Thank you so much. Thank you so much. Good evening. Thank you. Bye bye. Bye bye.
Bye bye.
Welcome, we are Bologna, calling newlyweds or those looking for a new bedroom set. Venti 5-door bedroom set is not only glamorous and modern, but has storage inside the bed. This bedroom set was £3,700, now £2,395. Bologna, we are here for you.